Good afternoon. Are you amongst those that believe that yeast infection is a toilet infection or that yeast infection is a sexually transmitted infection? It's a wrong belief, and I'm here today to teach you what you need to know about yeast infection. So sit down and enjoy this lesson. Also, invite your friends and the people around you to listen to this lesson. My name is Dr. Emefu Faustina Choma. I am a health educator. I am passionate about helping people sympathize with health misconception for the purpose of healthy living and well-being. Yeast infection is also known as candidiasis or thrush. Sometimes you hear people call it vaginal candidiasis or vulvovaginal candidiasis. Anyone, they still mean the same thing. It is a fungal infection and it occurs when there is an overgrowth of yeast in the vagina. There is always a balance between this yeast and bacteria. These bacteria are known as lactobacilli. They are the good bacteria. But when there is an overgrowth of yeast, it leads to yeast infection. Some of the symptoms include intense itching. This yeast infection is one of the commonest causes of itching, vaginal itching in women. When there is this intense itching, it can lead to cracks in the vagina or the vulva, leading to painful urination or painful sexual activities. There is watery discharge, increased watery discharge. There is also soreness and redness around the areas affected. There is thick whitish vaginal discharge with cottage cheese appearance. Some of the causes include overuse of antibiotics, wearing tight underwears and pants. It also occurs in pregnancy and people with immune suppression, such as uncontrolled diabetes, prolonged use of corticosteroid, and people with HIV and AIDS. It is also seen in people who are using contraceptive for a long period of time and for women who are on estrogen replacement therapy, example in menopausal women. Prevent yeast infection by the following: regulating the amount of antibiotics we take. It is best to get our antibiotics prescribed by a medical doctor to avoid overuse of antibiotics. Antibiotics work to kill bacteria in the body regardless of where the bacteria are found, including the ones in the vagina, which are good bacteria, thereby enhancing the growth of yeasts and reducing the population of the bacteria. Also, it is prevented by avoiding wearing tightly fitted underwears, regulating the amount of contraceptives one take, and by avoiding douching. By douching, one is reducing the population of bacteria in the vagina. Treatment of yeast infection. You can treat yeast infection by walking to a pharmacy to get over-the-counter drugs. It can be in form of tablets, cream, or pastries. It is advisable to use the pastries at night. Some people use vinegar as home remedies for the treatment of yeast infection. Some also use garlic. These are all wrong practices. It increases the intensity of the burning sensation over the cracked area in the vagina and the vulva. Thank you so much for listening to us and thank you for joining us today. See you next time. Bye.